An ACL repair, using the patient's own ligament, can be done if the ligament is torn off the bone and most of the ligament is left intact. The ligament simply gets repaired back to the bone. If the ligament is torn more toward the middle, or not much tissue is left after the injury, then a reconstruction must be done by drilling bone tunnels and using a graft. In this right knee animation, a type 1 ACL tear is shown. A spade-tipped pin is drilled into the repair location on the thigh bone, or femur, and out of the skin. A loop suture is placed on the back of the pin and is passed through the bone tunnel. The suture is saved for later. A fiber ring suture implant is passed through the ACL with a scorpion suture passer. After it is pulled tight, you can see the small ring create a luggage tag around the ACL. The single suture tail is cut off, leaving two ends. Here is when the surgeon must create the tightrope double loop. The suture tail number 1 from the card is put through the eyelet here. The other tail is pulled so the number 1 suture is passed in the knee, through the luggage tag ring, and back out. The striped suture is cut, leaving the white loop, which will become part of the tightrope double loop. Then, the number 2 suture on the card is removed, passed through the number 1 loop, and then back through the metal loop on the card, which is attached to the blue tab on top. The blue tab is pulled, and the number 2 suture is pulled up through the tightrope mechanism. You can see here that the double loop has now been created and is passed through the fiber ring suture in the ACL. All of the sutures get removed from the card. This procedure uses the internal brace technique, so a small tunnel must be drilled through the shin bone or tibia. A long pin is drilled up through the tibia. There is a needle inside the pin that is removed, and a wire loop is inserted into the knee up through the pin. This wire is saved for a later step. The white and blue sutures through the tightrope button are passed up through the tunnel in the femur, and the button is pulled through until it flips on the outside of the bone. The white tensioning sutures are pulled one at a time, and the ACL tissue is tightened back to the wall to heal. The blue tails of the fiber tape suture are loaded into the wire loop and are shuttled down the tunnel in the tibia. Following standard internal brace technique, a small pilot hole is created, and the fiber tape sutures are fixed to the tibia with an anchor. The surgeon will go back and make sure that the repaired ACL is nice and tight by pulling on the tensioning sutures one more time. Here is the final ACL repair.